Welcome back to the Living Diabetes podcast. I am your host, and today, in honor of World Health Day, we are zooming out from individual diabetes management to look at the global picture. Because diabetes is not just a personal health challenge, it is one of the defining health crises of our time, and the numbers tell a story that everyone needs to hear. Let us start with scale. According to the International Diabetes Federation, over 540 million adults worldwide are now living with diabetes, and that number is projected to reach 780 million by 2045. To put that in perspective, that is roughly 1 in 10 adults on the planet. And for every person diagnosed, there is estimated to be another who has diabetes but does not know it. Globally, nearly half of all diabetes cases are undiagnosed. The geographic distribution is striking. The highest prevalence rates are in the Middle East, North Africa, and the Western Pacific. Countries like Saudi Arabia, Kuwait, Qatar, and several Pacific Island nations have prevalence rates above 15% of the adult population. China and India together account for nearly a third of all diabetes cases worldwide, simply due to their enormous populations. But here is what often gets lost in the conversation. Diabetes is not just a disease of wealthy nations. In fact, the burden is increasingly falling on low and middle income countries where healthcare infrastructure is least equipped to handle it. Over three-quarters of people with diabetes now live in low and middle income countries. And in many of these settings, access to basic diabetes care, including insulin, glucose monitoring, and essential medications, remains severely limited. The insulin access issue is particularly stark. Insulin was discovered over 100 years ago. It costs very little to manufacture, yet millions of people around the world still cannot reliably access it. In some sub-Saharan African countries, a month's supply of insulin can cost a significant portion of a family's income. People die from diabetic ketoacidosis, which is entirely preventable simply because they cannot get insulin. This is a failure of health systems and global equity, not of medical knowledge. The economic impact is staggering. Global healthcare spending on diabetes exceeded $960 billion in 2024. But the indirect costs, including lost productivity, disability, and premature death, are estimated to be even larger. In developing economies, diabetes can push families into poverty through catastrophic healthcare expenses. In developed nations, it strains healthcare budgets and diverts resources from other priorities. What about prevention? The evidence is clear that type 2 diabetes is largely preventable through lifestyle modification. The Diabetes Prevention Program and similar studies have shown that modest weight loss and regular physical activity can reduce the risk of developing type 2 diabetes by 58% in high-risk individuals. That is more effective than medication. But implementing prevention at a population level requires political will, investment in public health infrastructure, and addressing the social determinants of health, including poverty, food environments, and education. There are bright spots. Several countries have implemented successful national diabetes strategies. Finland's program to prevent type 2 diabetes has shown measurable population-level reductions in incidence. India's National Program for Prevention and Control of Diabetes has expanded screening and awareness. The WHO Global Diabetes Compact, launched in recent years, is bringing together governments, civil society, and the private sector to accelerate progress. Technology is also helping bridge gaps. Telemedicine is expanding access to specialist diabetes care in remote areas. Mobile health applications are supporting self-management in settings where regular clinic visits are impractical. And generic versions of newer medications, including GLP-1 receptor agonists, are beginning to reach markets where they were previously unaffordable. What does all this mean for you as an individual? First, it means that your experience with diabetes is part of something much larger. You are not alone. Hundreds of millions of people share this journey. Second, it means that advocacy matters. Supporting organizations that work on insulin access, funding diabetes research, and pushing for better health policies all contribute to a world where diabetes outcomes improve for everyone. Third, it is a reminder that access to the medications and technology many of us take for granted is a privilege, not a universal reality. World Health Day is an opportunity to think beyond our own glucose numbers and recognize that diabetes is a global challenge requiring global solutions. Follow us on social media for daily updates and more content. Until next time, take care of yourselves.